qofkii oo rabo inuusan hadda dhalin xataa ilmihiisa waa furisan karaa.
soo dhawaad asxaabteeda qiimaha qaayaha badan. maanta yaa inoo marti ah dhaqtarina gubta, waa dhaqtarad ku takhasusay qaybta IVF-ta. asxaabtii waxay iga soo weydiinaysay qaybta IVF-ta ayaa maanta barnaamijkan loo hayaa asoo faahfaahsan intaa ka dheexo. Welcome mom. Thank you very much doctor, you gave me this opportunity today because my community, they are not getting that much from the internet and they are so confused about the IVF. So please can you figure out some points? So doctor, I want to ask like the process of IVF. What is the IVF and what's the process of IVF? As I know you have a more experience, so can you please explain to us?
Salma, IVF, as the word itself says, means in vitro fertilization. That means the process of fertilization, which generally in a natural pregnancy it occurs in the body of the woman in the fallopian tube. That process of meeting sperm and egg will be done in vitro. In vitro means in the lab. So that is like we are fertilizing egg and sperms in the lab. That is known as in vitro fertilization or IVF or test tube baby. Okay, so the process of this treatment IVF, it generally starts from the first consultation of husband and wife, and we have to evaluate both of them. For husband, just a semen analysis is generally required. If it is normal and we find sperm, then it is enough. For wife, we have to see her ultrasound whether the uterus is normal or not. We have to get some hormone tests done, and we have to see that what is the ovarian reserve, that means how many eggs she has in her body. Accordingly, we decide the dose of injections which are used in IVF. So generally the process starts from the second day of periods or maximum third day of periods. On that day, after seeing the preliminary reports, when we decide that this couple needs IVF and all the reports are normal and good to go for IVF, then on the second or third day, first a transvaginal scan will be done for the wife to see that there is no cyst, endometrium is shed, and she is good to start the IVF cycle in the same month. Then we start injections. These are hormonal injections, gonadotropins we call them. These injections, the aim of giving injections in IVF is to stimulate the ovaries. That means to create more eggs. You know, generally what happens, naturally only one egg will form, and rest of the eggs which are there in the ovary, they will die on their own. So in IVF, those eggs which were destined to die, we recruit them by giving these injections, and all of the eggs, or around 75 to 80% of those eggs which we can see in the ovaries, they start growing. And why we are giving these injections? The aim is to create more eggs. And why more eggs? Because if the number of eggs is more, then the chances of having embryos is more, and we can have more embryos, so that the patient can have multiple attempts with just one stimulation cycle. So this is the aim of giving injections to the female. These injections are generally given for 8 to 12 days depending on how the body of that woman is responding to the injections. After 5 or 6 days of injections, we generally add one injection which is given to prevent the premature rupture of the eggs which are growing in the body on their own. Because in IVF, we don't want them to rupture in the body. We want them to take out by doing a procedure which is known as ovum pickup or egg retrieval. So after 9 to 11 days of injections, when we see that on ultrasound the size of the follicles is around 17-18 mm, then we give an injection in the night. This is known as trigger injection. This injection is given for the final maturity of the eggs. It is not given for the rupture of eggs. It is given for the final maturity of the eggs. And 34 to 36 hours after this injection, we plan the egg retrieval process. So this process is a daycare process, and it's a very simple process done in general anesthesia. It is not painful, and it is done through ultrasound. Through ultrasound and with the needle, we go in the ovaries and we suck out the fluid with a suction pump, and then in that fluid the embryologist will see the eggs. Okay, so this is a procedure of ovum pickup which is painless, done under anesthesia. It's a 15 to 20 minute procedure depending on how many eggs are there in the body, and the patient can be discharged the same day after 3 to 4 hours. Then the process starts in the lab. Her husband will give the semen sample. Then the embryologist will select the better eggs and better sperms, and they will do the fertilization in the lab, that is IVF. Some patients need conventional IVF, some patients need ICSI. ICSI is the process in which we directly inject the sperm in the eggs. After that, embryos are cultured in the lab for 3 to 5 days. Generally, in a natural pregnancy, the embryo gets implanted in the uterus on 5th day. So, we at baby size, we also culture the embryos till day 5, that is a blastocyst stage, and depending on the hormone reports of the patient or the ultrasound report of the patient, we either transfer the embryos in the same cycle or we freeze the embryos. So we generally transfer 1 or 2 embryos, not more than that. Rest of the embryos will be frozen. If we've transferred the embryos in the same cycle, then the patient will be on some medications for 14 days, and after that with the blood test we will come to know whether the IVF process was successful or not. And in case we've decided to freeze all the embryos, then after 1 month we will start the medicines, and then we will transfer the embryos around 15th to 20th day of cycle. Okay.
Mama, you say that freezing and like fresh one. So which one is the best, freezing egg and fresh egg?
See, it is not like that which one is the best. It depends on the condition of the patient. So freezing, frozen embryos and fresh embryos, they give equal results, but the hormonal condition and the ultrasound report should be normal. If in the fresh cycle endometrial lining is good, her hormone reports are good, then we can transfer the embryos in the same cycle and the results will be same. But if there is a polyp, if the endometrial lining is not looking good, if the hormone reports are high, then we have to freeze the embryos and transfer in the later cycle. Sometimes if the number of eggs are more than 15, then also we freeze the embryos. So it is not like we do freeze all for all the patients, because the fresh and frozen has similar results, but we need to individualize that which patient need a fresh embryo transfer and which patient need a frozen embryo transfer.
Okay, is there any complication happen during this
IVF process?
Yes.
No, there are no long-term complications of IVF process. As such, the anesthesia is also very safe. There is just that pain of injections. The effect of those injections is generally during the stimulation process, the woman may feel some water retention and bloating, that's it. But that will also go once the IVF process is over, because the effect of those injections will be washed off from the body after 1 cycle.
Is there any food to avoid after transplant on this, or bed return? Because our people, they think like after IVF they have to lie down for 15 days and they have to don't eat like any food like spicy or oil food. They eat only rice and green, something like that.
See, regarding bed rest, no, it is not recommended to take full bed rest. Patient can do her routine activities, all her routine activities, but yes, strenuous work should be avoided. She should take her medicines on time, that is important. The other thing is that in case she has any problem, then like spotting, bleeding, then she has to report to her doctor and she may have to take rest for 2-3 days. So bed rest is not recommended. In fact, there are studies which say that complete bed rest may give less results as compared to the patients who are doing their routine activities. So the patient can do all the routine activities but not strenuous exercises. Okay, no abdominal exercises. and if whenever they feel that they are tired, they should sit and they should sit down. Now regarding the dietary advice, the patient should avoid eating unhygienic food. The reason is, we ask the patient, I generally ask my patients not to eat from outside. The reason being that we don't want the patient to catch any infection. So if the patient catches any infection, then the results will be affected, and we will have to put the patient on some medicines which may affect the result of IVF. So the patient should not eat from outside. If they are eating from outside, then they should eat only hygienic food, and it should be either directly cooked or boiled. Otherwise, in India we ask patients not to eat pineapple and papaya, because these fruits are supposed to be uterotonic. That means they expel the whatever is there in the uterus. But they are also not like, if you take 1 or 2 slices of pineapple or papaya, that will not harm the baby or the pregnancy. But if they are taken in excess amount, they may affect the pregnancy rates. Other than this, patient can eat everything. The patient can do all routine activities. Okay.
So let's come on to the eggs. When you are picking up, how many eggs is required to get? Is there any number for fixing?
See, no, there is no fixed number of eggs where we can say that the process of IVF will be successful. First of all, IVF doesn't guarantee 100% pregnancy. So the number of eggs is important, because if there are more eggs, the chances of having more embryos is more. But in young patients, sometimes with 1 or 2 eggs we get good embryos and they can get pregnant. And I have been patients where we have 15-20 eggs, still they don't get pregnant, or we don't have embryos. So there is no fixed number. But yes, if generally statistically when we see, then if there are 10 good quality eggs retrieved, then we will have 3 to 4 good embryos, that is day 5 embryos formed. So, but it is not a blanket. Some patients may have good number of embryos with less number of eggs. Some patients may have less number of embryos with more number of eggs.
The freezing the egg, it is like to freeze the only egg, or the one to put the mixture like semen and egg, then the embryo will freeze.
I didn't get you. You want to ask me what is better, freezing of eggs?
That already be done. Like some people they freeze only eggs, and some people they freeze egg with the semen to mix, like to make embryo.
So see, embryo freezing is always better, because the survival of embryo after thawing is better as compared to oocyte survival. If the patient is married or committed, obviously we will recommend embryo freezing. But if it is a single woman who is not married, or who is divorced or separated, then we can freeze eggs. Or if this is called social egg freezing, or if the woman has taken some kind of treatment, they need cancer treatment, and in the meanwhile they can get their eggs frozen, because if they are not married. If they are married, then also we recommend them to freeze the embryos. Okay.
So in that case, let me ask for my general question. So if, like, suppose for me, I can freeze my egg.
Yes, you can freeze eggs if you are not married. Yeah, you can freeze your eggs.
How long will freeze it?
You can keep them frozen for years, but in India it is up to 10 years.
10 years. Wow. So asxaaba marka la siin qofkaan kursanin ama qofkii oo rabo inuu san hadda dhalin xataa ay kumiis waa freezing garay karaa. Inaa freezing garay karaa waxaa laga wadaa fridge loo gelinayaa laaba loo gelinayaa ilaa 10 sano idin yaalay. Marka waxaa la leenahay waqtiga idin ka tumo ani hadda waa rabaa inaan freeze garay.